So thank you all for being here. Secretary Levine, Dr. Levine, thank you for being here. This today is from both of us, a plea to our fellow Pennsylvanians. Based on modeling by epidemiologists and public health experts, we've been talking about this for some time, and we all knew that there was going to be an upsurge, or we suspected pretty heavily there was going to be an upsurge in the coronavirus in the fall. And we're starting to see that. And we're starting to see the average case counts creeping up. The colder weather and a whole bunch of factors have probably produced this, but whatever the reason, this upsurge, there's evidence that it's starting. And so the fall resurgence is here, and while we always have to take this deadly virus seriously, now is really the time to double down on our efforts to keep ourselves and the people around us safe. So this is a plea to do just that, to keep us safe. We've seen what happens when people don't wear masks. That's a problem. We've seen what happens when folks don't practice social distancing. I mean, people just get sick. That's what happens. I don't like it. It's frustrating. You don't like it, but that's what happens. So we need to stay vigilant, and we need to stay together on this. I mean, the thing I think that has helped Pennsylvania, and we've done pretty well so far, is that in the end, Pennsylvanians have by and large stuck together. Last week, Dr. Levine introduced the team at the Department of Health that has been preparing for the fall resurgence here in Pennsylvania, and they have really been working hard, doing outstanding work. And I'm proud to have such a strong group of leaders in my administration doing this work. And the whole administration, we've been focused on this. I mean, I know I've been talking about this a lot, that there's going to be a resurgence that's coming, and we've been preparing for it. We have built a robust testing system. We've built a robust contact tracing system. I mean, we've been working on that. If you think back to where we were, how many hundreds we could do in a day back in early March when this started, we're now averaging in the high 30s. I guess the highest point is almost 40,000 tests per day. And we have contact tracing systems that are in place, including the app that is now being used in Delaware, New Jersey, New York, and Pennsylvania. And in Pennsylvania, we have 300, as of a couple minutes ago, 323,000 users, and that keeps growing with each day. Second, we fine-tuned our monitoring and response efforts when outbreaks occur. As I keep saying, we've built up a stockpile of personal protective equipment here in Pennsylvania, and we've put in place targeted mitigation orders that keep Pennsylvanians safe while allowing us to go about our lives to the extent we can do that. COVID is tough, no question about it, and it's frustrating. But together, Pennsylvanians are even tougher. And last 7.5 months have shown us that when we work together, we can do pretty amazing things. And we have. In the spring, in face of a disease that doctors and researchers knew almost nothing about, Pennsylvanians came together and we did a pretty good job we didn't exactly stop COVID in its tracks, but we did a pretty good job, and really proud of what we did. And over the summer, despite the fact that we still don't have a vaccine or a cure, and we had a little bit of an uptick, we were able to open up the Commonwealth actually back in May, before the summer even started, because Pennsylvanians worked together to keep the case counts low. Because we were low, because we did a good job, we could actually open up in May. And we did it in a measured way that actually kept us safe. We can do this again. And to stop the fall resurgence in its tracks, again, it comes down to all of us working together against COVID. Right now, we need to be vigilant about taking safety precautions and following the COVID guidelines. So this is just another plea. Remember, practice social distancing, wear masks, wash your hands. If you're sick, don't go to work. Each and every one of us needs to keep doing all of these things so that we know will help keep us safe, but also keep the people around us safe. And that's the best way to protect ourselves and our families. It also protects our healthcare workers. It protects our frontline workers and all the people who are most vulnerable to this disease. So Pennsylvanians, you matter. All of us matters. So do our actions. When we make good choices and follow health and safety measures, we see results. So let's keep working together to make sure this fall upsurge is as minimal as it can possibly be. Thank you. Now I'm going to turn this over to Dr. Rachel Levine. Dr. Levine.
Thank you. Good afternoon. Thank you, Governor, for your introduction. Today, I would like to discuss some of the data that we are using to assess where Pennsylvania is in regards to the fall resurgence and the COVID-19 pandemic. Today, we reported 1,103 new cases, which brings the total number of COVID-19 cases in Pennsylvania to 183,315. We have now seen 14 days where we have reported more than 1,000 new cases of the virus each day. Of these cases, 80% are considered recovered, meaning it has been more than 30 days past the patient's positive test or their onset of symptoms. As I have discussed previously, we know that a true recovery for many will take months as they continue to deal with chronic symptoms from the virus. Today, we are reporting 841 individuals that are hospitalized due to COVID-19. Now, this number has been steadily climbing. On September 22nd, we reported 422 individuals hospitalized for COVID-19. We expect these numbers to continue to increase as hospitalizations normally rise a few weeks after an increase in cases, and as we've been discussing, as the flu season starts. However, these numbers are well below what we saw in the spring, where at our peak, more than 3,000 people had been hospitalized on one day for COVID-19, had been in the hospital for one day. Our healthcare systems are better prepared to address the virus than they were in the spring. But as the governor just discussed, we all have to do our part together to prevent an increase in the spread of COVID-19, an increase in hospitalizations, particularly as flu season is here. Another trend we have been observing is an increase in percent positivity, both statewide and in specific counties. The statewide percent positivity, as reported on our early warning monitoring dashboard, is at 4.3% statewide. That's the highest it's been since August 7th. In addition, 21 counties have percent positivities of greater than 5%. Over the last 2 weeks, we have reported nearly 2,000 new cases of COVID-19 among school-age children, which are ages 5 through 18. The percent of cases we are seeing among 13 to 18-year-olds is higher than it has been since the beginning of the pandemic over September and October. In addition, we are seeing cases spread out among those 50 and younger, compared to in the spring when it was primarily 50 and older. Another data point that we are closely monitoring is the number of people who have reported going to a business or a large gathering 14 days prior to the onset of symptoms. It is essential that when the Pennsylvania Department of Health or the county municipal health departments call for these case investigations, that people provide this information to us as part of that case investigation process. We need that information to continue to improve our public health response and protect Pennsylvanians. It helps us because we know where they are at risk. For the week of October 4th through the 10th, 67% of people actually did not answer questions as to whether they frequented a business or attended a mass gathering. I can't stress enough how critical it is for them to give us that information and participate fully in the case investigation process and the contact tracing process. Those are the linchpins of our containment strategy. Of those that did respond and answered yes to having visited a business establishment, 50% had reported going to a restaurant. 14% had reported going to a bar. 13% to a gym or fitness center. 8% to a salon or a barbershop. And 26% going to some other type of business establishment. All that is on our data dashboard. And as the governor mentioned, we now have the COVID Alert PA app, and that is assisting us in the contact tracing efforts using Bluetooth technology to determine if someone has been exposed to someone who tested positive. Again, we are not tracking you through GPS. This is through Bluetooth technology. We're not tracking people. The app is a very important tool to assist in our case investigation and contact tracing processes so we can work to contact all those who might have been exposed to a case. As the governor has been emphasizing, and all of us have been talking about for weeks and weeks and months, each of us has a collective responsibility to protect our communities from COVID-19, and we must be united in this fight to stop the spread of this dangerous virus. We need to mask up, wash up, and maintain social distancing, and please download the COVID Alert PA app today. And as always, please stay calm, stay alert, and stay safe. And now I'll turn things back to Governor Wolf. Thank you, sir.
Thank you. Thanks, Dr. Levine. So any questions we would be happy to answer? Yes.
Question for Dr. Levine. The incidence rate is a number that you provide showing the number of positive case rates per 100,000 people per county. And the average incidence rate has been going up. It's about 68 statewide right now. But it varies quite a bit from county to county. So Bradford County with 228 per 100,000, Center County 188, Lebanon County 156, Lackawanna, Montour, Westmoreland, all so much higher than the average. What message does this send those people who live in Bradford, Center, Lebanon, Lackawanna counties? How should they take that number when they see it? What should they be doing differently?
Well, really throughout the state, every part of the state has been impacted. So every region of our state. So it might be different in some different counties, but every region, North Central, Northwest, Northeast, have been impacted by COVID-19 and have increasing incidence rates, as you've been describing, and we have increasing percent positivity rates. Those are two of the measures that we watch really carefully. It's not true in every single county, but it is true in every region of Pennsylvania. And this highlights the nature of this fall resurgence. This is not just in Pennsylvania, this is throughout the country, particularly in the Midwest and in the Mountain West, but throughout the country, we are seeing this fall resurgence, and we're seeing it in Pennsylvania. And I think the take-home message is that everyone, we're all in this together, and everyone has that collective responsibility. Everyone needs to take this very seriously. They need to wear masks. It's very simple to do. They need to wash their hands and use hand sanitizer. They need to social distance. They need to avoid large gatherings. And so we have seen this. I mean, there might be rural counties that have very low incidence rates, but we have rural counties that have significantly increasing incidence rates. This virus doesn't care whether you're in an urban, suburban, or rural area. North Dakota and South Dakota have some of the highest rates in the country. They are tremendously rural states. And so everybody needs to pay attention to this.
Much appreciated, Dr. Levine. Just a quick follow-up, because as you point out, some of these are very rural counties. Are these largely attributed to, and I know I've broken it down from week to week on different counties, sometimes it's a prison, sometimes it's Penn State, but do attitudes towards mask wearing or some of the harmful and false information and false narratives that have been put out there, are they informing what's happening in some of these counties, or are they playing a role? And what can we do about that?
Well, so there are a number of different reasons, as the governor mentioned, why we're seeing increases. I mean, in some areas, it might be schools, or it might be a college. In some areas, it might be a correctional institution or long-term care living. But in general, it is large gatherings. It is businesses such as, and we've shown evidence for this, of restaurants and bars and nightclubs. And it's also, though, relatively small social gatherings among friends and family. And that if people do not take precautions, the virus doesn't care if it's a family member or a friend. If someone is positive, maybe doesn't have any symptoms, the virus will spread. And so we need to be vigilant. We need to be vigilant during all of those different activities. Thank you.
Dr. Levine,
sure.
you mentioned earlier, if it wasn't you, maybe it was another healthcare professional I spoke to, but you mentioned that the treatments have certainly gotten better for those recovering from COVID-19 since March and April. Recently, Governor Christie, former New Jersey Governor Christie, talked about his journey in ICU. Remdesivir, of course, or however you pronounce it, that's available. But he also talked about this Eli Lilly monoclonal cocktail or something like
Okay.
that. Do Pennsylvanians have access to trial treatments like the president and the former New Jersey governor, or is that decision made with the healthcare networks like UPMC or
Sure.
something?
So, as you've been saying, the medical care for COVID-19 is much better than we were able to provide in the spring. As the governor mentioned, we know so much more about this virus than we knew, when it only been circulating for several months. And so the hospital care is better, the intensive care is better because we know more. There are specific treatments that have at least initial FDA approval for use. Remdesivir is one. There has been some up and down evidence about remdesivir. There was a recent article which questioned it, but overall it seems to be so far effective in terms of preventing some of the most severe complications and limiting the stay that you have in the hospital. In addition, there is a very common medicine, dexamethasone. That's a steroid used to decrease inflammation, which can cause a lot of damage. It's your body's immune response kind of overreacting, can cause a lot of lung damage, etc. Those treatments are available in any hospital that is treating patients with COVID-19. In addition, the FDA has given tentative approval for convalescent plasma, which is plasma from patients who have recovered. It's not clear whether that's helpful or not. Those studies are ongoing. But then you mentioned the monoclonal antibodies and other types of treatments. Those are investigational, which means that they would only be used as part of a study. Now, we have fantastic academic medical centers in Pennsylvania throughout the state who I know are participating in different studies about medications, but they wouldn't just be given to everybody. It would be part of a study. And some hospitals will be participating in those studies, and some hospitals would be participating in other studies.
So the participant, forgive me, would be a COVID-19 patient in a hospital?
It would be a patient with COVID-19 in the hospital as part of an investigational study for something like the monoclonal antibodies. But not every hospital would be doing that.
Who has insurance?
Although as part of a study, it might be given being given by the drug company, but you wouldn't. Not everybody would have access to those medications because your hospital might not be doing that study. And we don't know if that's helpful or not. I mean, it's part of usually they're double blind. I mean, we don't really know whether that treatment for a monoclonal antibody would be helpful or not from a statistical basis.
Dr. Levine, I have a question for you. It's kind of twofold, so
Sure.
I don't know how you want to take it. Number one, we're expected to be added on to New York's travel advisory list. Have you had any discussions with surrounding states about our rising case counts and how they're going to handle this? That's my first question.
One at a time. It's
Yes.
easier for me. We have discussions with other states all the time through the Association for State and Territorial Health Officials, an organization of which I'm president. We tend not to discuss that. I mean, basically, there are criteria for whether a state goes on a watch list. For our watch list or another watch list, and if you meet the criteria, you go on the list. So it's not like something we lobby about.
My second question is, something like the Penn State football team, they're expected to travel to Indiana, which is on our state's quarantine list, and then they're going to come back and play something like Ohio State right afterwards. What are your recommendations for that team as they leave the state and come back?
That's a real challenge. I think the governor had recommended that. We were pleased when the Big Ten initially decided that they were not going to play sports. They've since changed their decision, and I think it is a challenge if you're going to a state that has significant incidence rates, and then you come back, which is why we have certain states on a quarantine list. So, certainly I know that they have a lot of protections in terms of masking and social distancing, etc. And they also have very, very frequent testing, which is beneficial as well. But I think that the Big Ten playing is a challenge. Me or
Yeah, Mr. Levine, sorry. We've seen 2 weeks in a row now of new We've seen 2 weeks in a row now of new daily case counts over 1,000. What have you seen as the biggest contributing factor to the spike in cases?
Well, I think that, as I had mentioned, one is that the entire United States has significant increases. And we see that with the data that we get from the federal government. Really, almost every state in the country, with a few exceptions, are seeing increases in terms of their incidence rates and their percent positivity. So we've mentioned before, Pennsylvania is not an island, and so we are going to be reflective of what happens in the rest of the United States. We are seeing, when we track very closely any particular outbreaks, and so we have seen outbreaks in colleges. We have seen outbreaks in long-term care facilities, and we'll be speaking actually shortly on a phone call with the Department of Human Services about the RIC program, the Regional Collaborative Program, which is doing a great job helping both agencies with the long-term care facilities. We have seen some outbreaks in correctional institutions, and we work very closely with our own Department of Corrections and then counties on those as well. But from the general public, we are seeing community spread of COVID-19 in every region of Pennsylvania. Maybe not every county, but certainly every region. And so that is from frequenting a restaurant or going to a gathering, or it can be just relatively small gatherings of families and friends where people might not be as vigilant with social distancing and masking. However, someone has a asymptomatic case of COVID-19 and it spreads. And so we're seeing all of that in Pennsylvania, which outlines the importance of the measures that the governor and I have talked about. Do you want to follow up?
No, I'd actually like to ask a question to Governor Wolf.
Yes, of course.
Thank you. Yes.
Hi, Governor. Thank you. In regards to pre-canvassing mail-in ballots, what kind of conversations have you had with the House and Senate Republican leadership to get a bill passed that would allow that process to begin sooner?
Had conversations with the majority leader in the Senate, majority leader in the House, Speaker of the House, have had conversations also with county commissioners, Republicans and Democrats. And I think the pre-canvassing is something, as you know, I supported continue to support the county commissioners. I think they were calling for 21 days. I think there was an appetite to maybe go to 6, 7, part of Senate Republicans, less of an appetite, closer to 4 to 5 days on the House side. So I had direct conversations first to say, let's do something rather than wait for the courts to actually force something on us. Let's take our destiny in our own hands and do something. And last week even talked to the roadblock seemed to be, or the opportunity seemed to be in the House Republican caucus. So had a fairly long phone conversation with Kerry Benninghoff, the majority leader of the House, and thought that my argument was, listen, I know there's some areas we just don't agree, like poll watchers. But there are some areas where we do agree, and where if we take action, we could probably get something done. And like the security on drop boxes, like the need for some days. I know we disagree on the number of days that we ought to take for pre-canvassing, but I think everybody agreed we ought to have some pre-canvassing. So we had some conversations. There was some conversation about the number of days to count if you have a postmark on election day before 8 p.m. The Supreme Court ruled that we needed to give 3 days to actually count those if they came in not on the day by 8 o'clock on election day. And I was willing to even address partially that. So we had conversations. They didn't lead anywhere, and I understand the House Republicans just put out a press release a few minutes ago saying that that's dead. So I'm taking them at their word.
So can you expect anything pre-canvassing wise to happen before?
I would love to have pre-canvassing. I would love to I think Republican and Democratic county commissioners, every time I talk to them, this is something they're crying for. They would like to have the ability to actually start to canvass. Right now, it's at 7 a.m. on election day. And they'd like to have a chance to do that before. Again, they were asking for 21 days, which I'm fine with. but the House and Senate Republicans didn't want to give them that much and wanted to pack some other things in, which I think made access to the polls less easy, and which I'm against, and also concerned about things to do with intimidation. So I said, let's take those things off. Let's take things that we can agree on, that we at least know that we need days to pre-canvass. We might disagree as to how many, but we can at least understand and agree that we have more than we have now. Let's do something. And the House Republicans decided they didn't want to do that. Yes.
Governor Wolf, a quick follow-up on that. One of my colleagues shares with me that some counties have said that it's now too late to change plans and start pre-canvassing earlier. Do you think that that's the case, or if there was the will, would we still have sufficient time?
Well, both the Senate and the House are in town this week. So if the will were there, we could do something this week. And as long as we're not doing this after 7 a.m. on Election Day, anything that we decide that would add to that would be a benefit, I think, to counties. So yeah, there is time. Yes.
Governor Wolf, can you comment on the Lebanon County lawsuit that won against you on Friday?
Yeah, we'll probably be appealing that, and I haven't really had a chance to look at the ruling, so I'm not sure what the logic was of that. But again, I think, you know, as Dr. Levine said, one of the issues in terms of the upsurge has been restaurants and bars. So I think looking at how we deal with those restaurants is an important policy tool and part of anybody trying to address the challenge of this pandemic.
Governor Wolf?
Yes.
The other day I was driving my plan was to go to a flea market. And then as I got closer to the flea market, I decided to turn around because 95% of those folks were not wearing masks. Mm-hmm. And I asked this question to you respectfully. You ever get in your personal vehicle, maybe in disguise, and just kind of drive around and see what people are doing?
Yeah.
Just to kind of get a sense of what the people are doing.
Yeah.
You talk about the importance of us working together.
No,
What do you see?
Yeah, I see, and I think there's actually been a survey done that over 50% of Pennsylvanians are wearing masks. But that means, to your point, a lot of Pennsylvanians are not. And I think that's the kind of thing that we're trying to appeal to here. It's like seatbelts. I mean, there is a law. You're aware. There is a law that you have to wear a seatbelt in Pennsylvania, click it or ticket. But that's not what, ultimately, what drives seatbelt wearing is that individual Pennsylvanians decide, you know, I'm going to keep myself, I'm going to keep my family, I'm going to keep anybody in this car safe. So I am going to click it. And I think the same thing is true here. We need to get to the point where people internalize something like mask wearing. That actually, if everything else is going wrong, if everybody wears a mask, that's going to do a lot to keep Pennsylvania safe.
Are we too far in? Is it too political? Are we just too far in to whereas more people can't come on board?
I don't think so. It has been politicized, yes. But I think the truth is that wearing a mask works. And as more and more, truth is wearing a seatbelt works too. And as more and more people figure that out, I think we'll do a better job. And that's going to make a big difference.
Thank you.
Yep. Anything else? Yes.
Can I ask a question for Dr. Levine?
You bet.
Dr. Levine, there was some conversation about York County hospitalization numbers being inflated mistakenly over the past couple weeks. Do you have any comment on that, or do you know of any error that happened there that causes that inflation in numbers?
I have no specific information about that.
Okay. Thanks a lot.
Thank you so much. Oh.
Thank you.
When you look at the hospitalization data statewide, and you say 850 doesn't seem that bad, but do you know, are there any specific hospitals themselves that may be straining or close to straining?
So we do have that granular information. I don't have it at my fingertips. There are no hospitals in Pennsylvania which are under strain from COVID-19 patients. So we are in a much better position than we were in the spring in terms of hospital capacity, as the governor said, in terms of PPE, in terms of our ability to do containment with laboratory testing and contact tracing, and targeted mitigation efforts in place. And so we face the fall resurgence with better tools than we had before, but it's still a challenge. Thank you.
Thank you.
Thanks a lot.